Students, this is a very important class. Repeatedly asked question, and I want you to score the maximum marks. Poliomyelitis. It is an acute infection caused by the polio virus. It is an RNA virus and there are three types, type 1, type 2 and type 3. 1 and 3 are more common in India, and the contamination is by means of flies, sewage, milk and water. And the mode of transport is mainly the alimentary tract. On the picture we are seeing the RNA viruses. On my right, I am finding the victims of poliomyelitis. Look at this one. There are the various stages of poliomyelitis. Please follow this one. Initially, the alimentary phase, where the patient is getting infected with the organism. It spreads to the cervical lymph nodes, mesenteric lymph nodes, etc. And this is called the lymphatic phase. After this, it goes to the heart. All the lymph will drain to the heart. From there, it goes into the circulation, that is called viremia. The blood contains the virus. So, from there, the extraneural tissues can be affected. Finally, you have got the neural phase where the brain and the spinal cord are affected. So, please remember alimentary, viremic, neural phases. The incubation period, that is a period till when the disease does not manifest. After this, there is a development of the disease. It is about 7 to 14 days. The polio infection can be silent or it can manifest, leading to meningeal symptoms or even paralysis. Neuropathology is the most important one. All of us know it causes some kind of weakness of the muscles. It affects the anterior horn cells. And there is a flaccid paralysis. Flaccid means some kind of weakness, but there is no sensory loss. So this is a virus and this is a nerve cell. Once it gets attached, you find that it invades and then it causes the damage to the nerves. It also affects the other vital centers for the various functions. Cranial nerve nuclei also. You must draw this particular picture. The manifestations are, it can be silent, no manifestation. And in some cases it is abortive, so there is no development. Or there can be a non-paralytic one, aseptic. And finally, paralysis, this is the most important one. The patient will be having some signs of meningeal irritation, like headache, vomiting, etc. So it is something like a viral meningitis or meningoencephalitis. Neck stiffness will be present. And there is a tripod sign. This is very important. I have marked it. So you find that the patient is having weakness of the muscles and cannot bend and needs the support of the arms and the legs. So when he is asked to kiss his knees, he can do it only by flexing the legs. As a result of which there is a tripod sign, like a triangle it becomes. The grading is as follows. One, there is minimal movement, then there is a movement against gravity, and finally moderate resistance, normal power. So this will be graded and measured in the patient. Paralytic poliomyelitis occurs before or even after the fever. The illness can be biphasic. There is a fever, period free of fever, and then recurrence. The muscle pain, tenderness, etc. will be there. I am not going into it. You people go through this particular box. Biphasic fever, paralysis, hernia because of the weakness of the muscles, and the sites can be spinal, bulbar, bulbospinal, or respiratory. These are the most important regions which are involved. The complications can be spasm of the larynx, pooling of the secretions, and there can be pneumonia, edema, etc. developing. So these are the important ones you people will have to by heart, the paralytic poliomyelitis. And the treatment is, you should not do a lumbar puncture or give an injection. That should be avoided, no injections. Swab can be taken for isolating the virus and supportive relief from the pain. Body alignment to avoid any skeletal deformity. All of us know what kind of a deformity the polio can cause. So we will have to minimize it by giving adequate support. Fluid intake and respiratory failure, we don't notice it. We see only the legs and hands, but the respiratory failure is most important. And for the differential diagnosis, differential means the other causes can be meningoencephalitis due to other organisms. The prevention is by means of the vaccines, Salk or Sabin's vaccine. So this is very important, and you people will be aware of the polio eradication program. And there should be no epidemics, and that can be avoided by avoiding crowded places and fluorination of the water. So this is a very important topic, kindly by heart.